I'll be discussing today about fertility preservation options in women with endometrial cancer. Now, gynec cancers most commonly affect women in their reproductive age. And now especially, when women have started delaying their childbearing age, they are even more prone to such cancers. Endometrial or uterine cancer is one of the most common cancers of the female reproductive tract. And almost 5% of these female are below 40 years of age or have yet not delivered a child. Now, talking about endometrial cancer, the treatment is pretty straightforward if you think about it. It's panhysterectomy, which means removal of uterus and both your tubes and ovaries along with your lymph nodes. But that's where we go wrong. It's very important to know whether these women are still desirous of pregnancy and fertility, because if you've done this major surgery, their reproductive career is over. Now, if the answer is yes, the woman is desirous of fertility, the treatment doesn't become straightforward. Then you have two options. One is, as usual, our age-old ART. These women, before they undergo their radiation, their chemotherapy, or as a matter of fact, their major surgery, if you have enough time, can be stimulated. Their eggs can be extracted and frozen. If they are married, you can freeze their embryos. And in case if you don't have time, it's a little late, you can always do an ovarian tissue cryopreservation. The advantage is it's quick and you can save a large yield of eggs in them, wherein a small chunk of your ovary is removed laparoscopically and auto-transplanted back into the same position once you're cancer-free. And the most common situation that arises is the patient comes to you after the surgery is done, but the battle is still not lost. They can still go ahead with egg donation if the ovaries are removed, their husband's sperm, do an ART, and of course, there's where gestational surrogacy is a blessing. Now, there's a second, much more conservative approach to treating these patients who do not want the uterus removed. Now, that's a little tricky. First of all, you have to screen this patient meticulously. Two issues are very important. One is the grade of your tumor, the invasion of your tumor, the stage of your tumor. Only all of these are in alignment and at superficial stages, then you have an option of conservative treatment and saving your uterus. Now, there are multiple ways in which you can be treated to save your uterus. The most common is you're given a high dose of progesterone to suppress your initial stages of cancer. And then, once your cancer is subsided, you're given a chance at fertility and then seen how it goes forward. But it's very, very important to know which patients to select. These patients should be given the entire detail of how the treatment will go, which includes their treatment options, their recurrence rate, and very important is their extreme need of proper follow-up. Of course, their obstetric outcome and complications, if any, and the survival rate, of course. There is an option where these cancers can be subsided, uterus can be saved, but mind you, that's not for all of them. So to end, I'd like to say, actually, endometrial cancer has a very high survival rate if caught early. But my point again here is, when we're treating these cancers, we talk a lot about family support and the requirement for it, but we forget a crucial thing, giving them an opportunity to actually have a family in future. Once we start thinking about all these points, then only I think we will treat cancer in its full aspect. Think about it. Thank you.